All right, let's dive right into a really fascinating medical puzzle. We're going to be talking about a condition called myasthenia gravis. Now, it's been nicknamed the Great Imitator, and for a very, very good reason. It's really a story about mistaken identity inside the body, a critical communications breakdown, and ultimately, a delicate balancing act for survival. I want you to just imagine this for a second. What if you woke up feeling totally fine? But the more you did, the more you talked or chewed your food or even just tried to hold your head up, the weaker you got. Well, this strange, frustrating paradox, it's the daily reality for people with myasthenia gravis. And we're about to find out exactly why it happens. So here's our game plan. First, we'll explore why they call it the Great Imitator. Then we're going to zoom way in on the communication breakdown that happens at a cellular level. After that, we'll unmask the real culprit, talk about the high-stakes tightrope of a medical crisis, and finally, look at what it really means to live with myasthenia every day. Okay, so let's start our investigation with the mystery itself, the really confusing and, frankly, misleading symptoms of myasthenia gravis. This quote really nails the biggest challenge right from the start. The symptoms can look a whole lot like other things, maybe a stroke or MS or other serious neurological problems. That's why it can be so tough for doctors to pin down at first. It's a true master of disguise. So what are the clues that doctors are looking for? Well, a lot of the time it starts with the eyes. Things like drooping eyelids or seeing double, but it can also mess with your speech, your ability to swallow, or even make your limbs and neck feel incredibly weak. But the real smoking gun, the thing that screams myasthenia, is that last point. The symptoms get worse the more you use the muscle, and they get better when you rest. It's almost like a phone battery that just won't hold a charge. Okay, to really get what's going on here, we have to zoom in, way in, to the microscopic scene of the crime, right where the messages from your brain are getting lost in translation. And here it is. Welcome to the neuromuscular junction. The best way to think about this is like a tiny, super important communication hub. It's that critical gap where a nerve ending has to pass a chemical message across to a muscle fiber, basically telling it, hey, time to contract, get to work. So here's where it all goes wrong. In a healthy person, your nerve releases a chemical messenger, acetylcholine. Let's call that the key. That key travels across the gap and fits perfectly into receptors on the muscle. Let's call those the locks. Key in the lock, the door opens, the message gets through, and bam, the muscle contracts. Simple enough. But with myasthenia gravis, here's the twist. The nerve is totally fine. It's sending out plenty of keys. The problem is on the other side. The locks on the muscle are either blocked, damaged, or just plain gone. So the keys have nowhere to go. The signal just fizzles out, and the muscle stays weak. So if the locks are being destroyed, who's the vandal? Who is doing this? Well, the search for the culprit leads to a pretty shocking discovery. Turns out, it's an inside job. Yep, the villain in this story is the body's own immune system. For reasons we don't fully understand, it gets confused. It creates these rogue agents called autoantibodies. And instead of doing their job and fighting off germs, they go after the body itself. They specifically target and attack those acetylcholine receptors, the very locks our muscles need to work. It is, quite literally, a betrayal from within. And listen, this isn't just a theory. We can find the evidence. For about 80% of patients, the proof is right there in their blood. A blood test can actually detect these specific, destructive autoantibodies, confirming that yes, the immune system has gone rogue and is actively attacking those muscle receptors. So the next logical question is, where are these bad orders coming from? Well, all signs point to the thymus gland. It's this small organ, sits right behind your breastbone, and it's basically a boot camp for your immune cells. In most people with myasthenia, the thymus is abnormal, and it's believed to be the command center that's wrongly training the immune system to launch this self-destructive attack. Now, this internal battle can sometimes escalate, and I mean escalate fast, into a full-blown, life-threatening emergency. And this is where doctors have to walk a razor-thin diagnostic tightrope, because making the wrong call can be disastrous. So imagine a patient comes into the ER. They have severe muscle weakness. They can barely breathe. Here's the terrifying dilemma. This could be a myasthenic crisis, which is caused by too little medication. The muscles are dangerously understimulated. Or it could be a cholinergic crisis caused by too much medication, which leads to overstimulation. They look almost identical, but their causes are complete opposites. So how do you figure it out when the stakes are that high? Doctors use a really clever high-stakes diagnostic called the edrophonium test. They give a tiny dose of a special drug, and then everyone holds their breath. If the patient's weakness suddenly gets better, it's a myasthenic crisis. They need more medication fast. But if their weakness gets worse, it's a cholinergic crisis. They've had too much. It's this dramatic, critical moment of truth that tells them exactly what to do next to save a life. So once the diagnosis is clear and any crisis is managed, what happens then? Well, we move from the high drama of the emergency room to the quiet, long life journey of managing a chronic condition. Generally, treatment is a three-pronged attack. First, you control the symptoms. There are drugs that basically help those keys, the acetylcholine, hang around in the gap longer, which gives them a better chance of finding a working lock. Second, you go after the root cause with immune-suppressing drugs to calm down that autoimmune attack. And third, for many patients, is surgically removing the thymus gland, that faulty command center, which can actually lead to huge improvements or even remission. Living with this also means being incredibly vigilant about other medications. A whole bunch of common drugs. We're talking certain antibiotics, anesthetics, even some heart medications can actually interfere with that fragile nerve-muscle communication and make the weakness dangerously worse. It just adds another complicated layer to the daily balancing act of managing this disease. And that brings us to this final, really important reality check. This quote reminds us that myasthenia gravis isn't really a battle that you win. It's a balance that you have to maintain, day in and day out. Treatments are amazing, and they can control the symptoms and hold back the immune system's attack. But a certain degree of weakness often remains. It's a constant negotiation with your own body. So the question isn't just about how we fight it, but maybe more importantly, how do we learn to live with it?